Dr. Alex Buller. So Alex is an ophthalmologist at the Eye Surgery Hastings in New Zealand. This hospital is certified carbon neutral, which, mind-blowing to be perfectly honest. Love to see it here. And it offsets 125% of its carbon emissions. It has New Zealand's only solar-powered operating theatre and is enrolled in the Race to Zero. So without further ado, Dr. Buller.
I'm Alex Buller. Thank you very much for the very kind introduction. We're talking about how to clean an eye clinic with zero waste. This is where we are. We're in the east coast of New Zealand, a long way away. And this is our clinic. We've got 12 employees, so we're small fry compared to several of the speakers today. These are our main green credentials. We're solar powered, we're certified carbon neutral, we're a proud member of the Global Green and Healthy Hospitals, and we're a Race to Zero partner as well. The aims of this talk are to be interesting and relevant to people at the forum. We want to make it so that you can have practical steps. You can listen to this talk and then do the same things yourselves. And we also want to try and show that it's scalable to all healthcare facilities and all teams of all sizes. Whether we hit the bullseye for those things is entirely up to you guys as the listeners, though. So let's talk about cleaning. With a healthcare facility, we've got everything that you expect. You've got a reception area. We've got a clinic, and there's a picture of our clinic there. We're pretty heavy on electronic equipment. And then we've got an operating theatre, and that needs to be cleaned to operating theatre standards. And CSSD is the instrument sterilisation facility as well. And that also needs to be cleaned to potentially a higher standard than the operating theatre. Other angles to think about for ophthalmology, and we deal with highly transmissible conditions continuously, all the viruses you can think of. We're handling body fluids with every patient and mucous membranes, usually without gloves on. We do face-to-face examinations for slit lamp examinations and others. We're very close to our patients. We do multiple tests per person. It's not unusual for somebody visiting our clinic to have their chin on 5 different chin rests in one visit. So we need to clean a lot in between patients. And as a green place, we're going hard on the reusable consumables, so they need to be turned around in between patients. And eye clinics, if you're not familiar, lots of patients come. It's very high turnover. So what are the ingredients of a perfect cleaner? You want it to kill all bugs, you want it to do it quickly, and you want it to be safe to use. And also for this forum, you need to think about all of these goals for the sustainability agenda. This is an average detergent wipe, and for obvious reasons, it doesn't hit many of those targets. So another nice way of putting things is the green premium, which is a term that Bill Gates, the founder of Microsoft, has come up with for his fairly recent book. He's described it as the difference in cost between doing something in a way that emits greenhouse gases and doing the same thing without the emissions. Here's his example. If a gallon of aviation fuel costs $2.22 and a gallon of biofuel costs $5.35, then the green premium is the extra 140% you're paying for the green one. For us, we like to think of it a bit further because for costs, that's the starter, but also for healthcare, you never want to compromise on quality. And for time, for people actually doing this, everybody familiar with working in healthcare knows that you're not going to be able to introduce something that takes more time very successfully. And also the project resources, how much time and effort does it take to get something off the ground? So let's talk about disinfectants. This is the lineup. They're a fairly unsavory bunch of chemicals. The one we want to really focus on today is hypochlorous acid. Why do we want to do that? Well, this is a document, a 57-page document that's available on the World Health Organization website. It's an application to get hypochlorous acid into the WHO Essential Medicines list. This is table 3 from that. It compares hypochlorous acid with bleach and hydrogen peroxide to kill 3 bugs: E. coli, Pseudomonas, and Staph aureus. Most people have heard of at least one of those. Hypochlorous acid killed them all in less than a minute. Bleach took 5 minutes, 20 minutes, and 10 minutes. Hydrogen peroxide didn't touch the E. coli and Staph aureus and took about 15 minutes for the Pseudomonas. In fact, hypochlorous acid kills everything very, very quickly. It kills bacteria, kills viruses, it kills fungi, it does prions. All the timings, most of those timings are from this document. I haven't had time to look them all up, but it kills everything there is. It also penetrates biofilm, which is the slimy stuff bacteria put on their outside to stop themselves from being attacked. And there's been 0 cases of resistance to hypochlorous acid ever recorded. So if it does all that to bugs, what does it do to people? Actually, it's incredibly safe. It's used by our white blood cells to fight off bugs. So that's the theory of why it's so safe to people. It's safe to skin, it's safe to eyes, it's hypoallergenic. You don't need any special storage, and you don't need to wear gloves or masks to handle it. It's been used in lots of medical uses. It's been used to clean wounds and ulcers and burns. It's used on eyes, and it's been used for washing out the abdomen in bowel surgery as well. This is, again, from the main document. It's a summary of all of the different disinfectants. If you can't read this, I'll read them out. The first column is the hypochlorous acid. It kills bacteria, it kills viruses, it kills spores, it kills fungi, it inactivates human papillomavirus, it kills prions, it can remain stable for years, it's non-toxic, it's safe for skin, it's safe for eyes, it's safe for mucosa, it's safe to inhale, it's hypoallergenic, you don't need PPE. You can put it on food, it's rinse-free, you don't have to wipe it off food before you can eat it. It's environmentally friendly, it's biodegradable. If you pour it down the sink, it's gone in a few minutes, back to its base ingredients. It doesn't explode, it doesn't catch fire, it doesn't stain things, there's no resistant organisms, it doesn't smell funny, and it cuts through biofilm as well. So, I know what you're thinking. If it does all that, and it sounds too good to be true, why have I never heard of it before? Well, there is a problem with it, and it's quite a big one, and that's that it can't be made in a very stable way, or it couldn't until some recent technological advances. So it was first described in 1834, and it was used in World War I and World War II for wound care, but then never became popular because it's unstable after it's been made, so it breaks down again, so you can't store it for very long. It breaks down with temperatures over 25 degrees and with sunlight as well. So recent technological advancements have meant that those things have been overcome. And so the top line is a PubMed search for hypochlorous acid, and there's 9,500 hits on it, and about half of those are in the last decade. And the companies are now making products that can be stored and used for years, and also making machines that you can have in your place and make it yourselves. How do you make hypochlorous acid then? And we've probably been saving the best till last. This is the ingredients list. You need salt and water. And then you pump in a large amount of energy with electricity, and that literally rearranges the molecules and comes up with hypochlorous acid. There's a little bit more to it than that. It depends on what pH it is in terms of how much of the free activated chlorine turns into hypochlorous acid. So at pH 7, it's 70% hypochlorous acid. At pH 6, it's 90 to 99% hypochlorous acid. So the third ingredient that some of the manufacturers of the machines recommend is actually vinegar, weak acid. If it gets to be alkaline, it literally turns into bleach. So it's on the same sort of chemical scale as bleach. So you can think of it like bleachers, much more effective, but much kinder older sibling. So this is how we make it here. We've got a machine. Inside the machine is a bottle, and the bottle, that's where we mix the salt and the water. There's Belinda, our nurse, mixing one. And then we have these testers. We make it fresh every day, and the testers check the pH and what parts per million the machine is producing the hypochlorous acid at. This machine that we've got, it runs at about the same pace as turning on a tap. Our infection rates, we've been doing this for 3 years. In the clinic, 4,500 appointments and 1 infection, and in theatre, 1,300 or so operations, and no infections during the 3 years. Also, it gives us lots of big green ticks on these sustainability goals, which is very nice. Okay, so what do we do to clean our clinic specifically? So this is our clinic room. It's a pretty busy place, and there's lots of electronic stuff and lenses and so on. We put the hypochlorous acid into squirty reusable plastic bottles, and we use reusable cloths. And we also put a 5 ml aliquot of a neutral detergent in the bottle as well. So we did some ATP luminescence, some testing around our clinic with water versus hypochlorous acid versus water plus detergent versus hypochlorous acid plus detergent versus standard disinfectant wipes. And the only one of those that gave us a perfect result every time was the hypochlorous acid with some detergent in it. So the bottles are reused. The cloths are stored in a bucket of hypochlorous acid overnight and then laundered the next day. And we have different cloths for different areas of the building. And also our reusable instruments are stored in hypochlorous acid and then washed with distilled water in between uses. For the reception area, it's very much the same story. We have these floor scrubber dryer machines, and we pour the hypochlorous acid into that and it goes straight onto the floor. And for the operating theatre, very similar again. For if anybody's familiar with cleaning operating theatres, there's one or two more rules you have to follow. So no double dipping for the terminal clean. And then in between patients, we wipe things down again with the same hypochlorous acid and detergent mix. This slide's about our being solar powered. So this is actually today's solar power production on the top half there. So the yellow line is the electricity we produced, and the purple line is the electricity we've used. We're actually installing some batteries, so that bit where we turn up and turn the heaters on a spring morning is going to be solar powered as well soon. We do all of these things at the bottom. We do our heating and cooling and cleaning and the laundry and the hypochlorous acid production and instrument sterilization at no emissions and no cost. Obviously, the simple things are simple. We do these during the day when the sun is shining. Other ideas that we use and worth sharing in a forum like this, we use biodegradable masks, we have biodegradable instrument pouches. CSSD, the instrument sterilization department, provides as much distilled water as we want. They have a machine that creates the distilled water before it goes into the sterilizers, and we used to ship it in bottles, but now we produce it on site. I'm sure all hospitals departments can do that for you. And eco detergents are perfectly adequate for our needs when we're using hypochlorous acid. We've recently measured our waste for our carbon neutral certification. Our clinic waste over a week was 1.98 kilograms for the whole clinic, and the laundry waste 0.47 kilograms. So green premiums, the cost is much better. The machine cost about 10,000 New Zealand dollars. The bag of salt, 20 kilogram bag of salt, cost about $100. We're still on the same one 3 years later. The quality, we're killing bugs, more bugs, better, and it kills them faster as well. And the wipe down takes no less time than anything else. And project resources, it's about 2 hours per person for somebody to be fully trained in all of our processes, including being able to make the hypochlorous. And also, incidentally, that's about how long it took the plumber to install the machine in the first place as well. So thank you very much for your attention. These are where we got the things from. There are other manufacturers, but the hypochlorous acid machine, the biodegradable mask, and the biodegradable instrument pouches, those are our suppliers. Our contact details are at the bottom. We're very welcoming for people to get in touch with us if they want to ask about anything at all. Thank you very much.